She'll always announce that. So as a reminder, we'll be recorded. As we go along, we'll try to speak slower because we keep getting that feedback. Just put something in the chat if we're going too fast. So we'll talk about food safety and foods and social distancing for July 4th weekend. Next week, we'll take off. And then the following week, we're going to relaunch Project DFEND, and it will go through December as more like a nutrition and physical activity short course. So, and we'll ask people who are interested in, you can participate at any time, but we're going to take some pre-assessments about like mood and sleep habits, and physical activity habits and dietary habits. And then at the end, we'll ask people also to complete some surveys, and we'll circulate that, the new DFEND, as soon as we have that information. So today is going to be led by Angela Tacinelli and Sarah Jones. And we just want to also give a big shout out to the Division of Agriculture and Extension for funding Project DFEND and agreeing to fund us through the rest of the year. So Angela.
Okay, is everyone able to see my screen okay? So this week we wanted to focus on just tips for staying safe over July 4th weekend, but we also touched on ways to kind of eat mindfully if you will be attending some social gatherings, food safety, as well as some healthy recipes. So we'll kind of just glance over all of that. And Dr. Baum just mentioned this, but just thank you to the University of Arkansas Division of Agriculture Cooperative Extension Service for providing funding for Project DFEND. And information about the date that it'll be continuing after the holiday weekend will be shown at the end. So if you miss that information, it'll come back up for you. So just to kind of start, we wanted to kind of go over some tips for eating mindfully during social gatherings. So this goes for like whether you're in group gatherings and social situations of any kind. Start by just being mindful of your food choices. And we say this because when you're in group gatherings or social situations, we tend to make some unhealthier choices, or we're so caught up in the moment and socializing that we're not actually taking a few moments to stop and be conscious of what we're eating or what we're choosing to eat. So if you do have a blank plate in front of you, start by filling it with your healthier options. And so those would be your fruits and vegetables. Skip over the junk food and the sweets if you can. And we say that because if you're going to start eating healthy, you're going to start out on the with the right foot and basically fill yourself up a little bit more so that you don't have as much room for those unhealthier options. But it also extends beyond food, so start with healthier beverage choices as well. Skip the soda, skip the sugary alcoholic beverages, try to start with water or just like a flavored water, and that will also help you start off a little healthier for the day. Avoid eating too much. So some tips for avoiding eating too much. Start with smaller portions and be aware of what serving sizes are. So if you eat in smaller portions, you take a little bit at a time, you go back for more. That way you're able to check in with yourself and see how full you are, how hungry you may still be, and then take breaks throughout the day. So when you finish your plate, don't just jump right back up to refill. Give yourself and your mind a little bit of time to register, oh wow, I did just eat some food. How much did I eat? And then that way you can kind of check in with yourself and pay a little more attention to, again, how full am I? How hungry may I still be? Am I just caught up in it, or am I okay for right now? And then lastly, continuous eating can lead to overeating. So I mentioned check in with yourself, take some breaks, be mindful and pay attention, but also physically distance yourself from the food. So when we're around food, we tend to be very susceptible to grabbing at it and kind of picking at it in small amounts, but that accumulates to a lot more than we realize we're eating. And so physically distance yourself from the food. Try not to sit or converse in front of the food table or over the food table. And that way you may be less likely to kind of like continuously eat throughout the day. And then we wanted to give some tips for avoiding germs if you are hosting or if you're attending a social gathering for July 4th or just in general with COVID right now. So if you're hosting, some tips would be to try serving food in individually portion sizes. So that could be if you're having chips and dip, try having them pre-portioned into individual cups so people just have to grab the cup itself with some of the dip and chips in them. And that way, you know, they're not constantly going back into the same serving bowl. Also try to pre-wrap silverware and napkins together. So that may sound like, you know, oh, why would that be important? Well, when people are going up, especially if it's a buffet style gathering, when people are going up to grab their utensils, a lot of times they're bunched together and they may be touching more than just one. And so to avoid spreading those germs, try to just kind of like already have them prepackaged, lay them out a little easier for your guests. And that way there's less likely to be some cross contamination. Spread food out with the space that you're working with so that people also spread out. People tend to socialize and gather wherever the food is. And I know that's like, you know, where we feel comfortable and it's a social gathering, but with COVID, we really don't want people standing over the food or trying to cluster up in big groups. And so if you spread the food out, people are also likely to spread out. We do recommend obviously washing your hands as much as possible, but to kind of help nudge your guests, if you have access to or able to get it, we recommend putting some hand sanitizer stations near the food tables. And that way, regardless of if it's an indoor or an outdoor space, people are trying to sanitize before they're touching the food or going at the food. And then lastly, if you are having a big serving bowl of a chips and dip or a pasta salad, whatever it may be sure it has a serving utensil. You don't want people going in with obviously their own utensils. Not that I hope many people are doing that, but you just want to make sure that, like, again, to avoid that cross-contamination, people are using a proper serving utensil for taking food onto their own plate. Now, if you're attending a gathering, there's still some responsibility that can be had as the guest. So when you arrive, wash your hands immediately, and then also try to wash your hands frequently, or if they are providing hand sanitizer stations, use them out of respect for other guests as well as the host. If you are planning to bring food, try to be conscious again of trying to individually portion it for other guests or bring the proper serving utensil that may be needed to ensure that germs are being minimized. Avoid sharing food and drinks with other guests. That should go without saying, but even if you feel like you can trust them, during these times, it's really better safe than sorry to just not share those things with others. And then, as we've been encouraging since almost the start of DFEND, try to wear a mask whenever possible. I know it may be a little bit harder to breathe outside if it's humid, or it may be uncomfortable, but just consider it the new style trend and just try to do it out of respect for other guests. And if you do want some more information about how you can best protect yourself, and in protecting yourself, you may be helping to protect others as well, you can check out the CDC website, cdc.gov/coronavirus, and then click on their tab, How to Protect Yourself. And they have an abundance of information on tips and things to be mindful of when going out and about to protect yourself and others. Sarah?
Hi, everyone. So kind of just building upon the coronavirus in your gatherings. One of the things you can do is to kind of remind yourself if you're caught in these scenarios. So avoid the 3 C's. And so closed spaces, crowded places, and close contact. So by closed spaces with poor ventilation, that's hanging out in a garage or in a tightly packed kitchen. So while there is air and maybe there's fans or air conditioning recirculating that air, that is not as good as the great outdoors. So really try and move any limited gatherings that you're having. Try and move them outside. I know it's hot, but I'd rather you be kind of safe than sorry. building upon crowded places. So, of course, crowded places with many people nearby. This year, while not as fun, try and limit the number of guests this year to close and immediate family and very close friends. You know, you can't control how people are behaving outside of yourself, and so you really want to limit the amount of exposure for you and your family. You know, we know that you may not suffer severe illness from COVID-19, but there's a very high chance that someone you love might. And so really avoiding those crowded places, large number of guests, large number of family. And then ultimately close contact settings within a close range. So this goes for those limited number of family and friends you do have. Really try and limit how close you are to them. We know about social distancing and kind of that 6-foot rule. So really don't be super close with people that are not in your immediate family that you already live with. So stop the spread of COVID-19, maintain that social distancing, even at these holiday gatherings, and then continue to wear your face coverings. And so throughout this summer project, we have made a couple of resources related to COVID, and I've linked it here to the homepage. And so there's a face coverings graphic, and there's also a gatherings in COVID-19 that has kind of this information that you are more than welcome to share. On top of that, so you have these avoid the 3 C's, you know, to protect your friends, your family, yourself. But also you have to keep continuing the other measures to kind of stop the spread of COVID. So easily accessible running water, soap, and preferably disposable paper towels, not that same kitchen towel that you are using over and over again. You know, that's not quite what we're aiming for here, even though it's a little bit easier. Have alcohol-based hand sanitizers available. So as Angela was indicating, have them, you know, at where you're going to eat. When people come into your home or your backyard, make it accessible, make note, you know, be sure to just mention it to people. Sometimes they look over it in the hustle and bustle of a family gathering. And then again, limit that self-serve buffet lines for food. So encourage those single serving dishes. A couple of other options are a designated server, so cafeteria style. Have your own little personal lunch lady at your gathering where you're dishing out the food onto plates. So people aren't sticking their hands back in there, whether it's for chips or if it's something like a casserole, you just have somebody dishing it out so that you're not having a lot of that cross contact with utensils. Or another option is, instead of going back and doing the kind of potluck style gatherings that we're used to for the holidays, go ahead and just have family units bring their own food. You can still eat together and bond and, you know, enjoy your time. But a family unit bringing their own food kind of avoids the situation altogether, which is another possibility. And then, of course, we all should be doing this anyway, but disinfecting high-touch surfaces. So for me, that is your doorknobs, your kitchen counters, I typically do my refrigerator handles, any place that people are getting in and out, drinks, food, anything like that. Go ahead and wipe those surfaces down to kind of just prevent the spread of COVID. We know that people are restless, and we realize that people are going to go to some form of gathering, whether it's recommended or not. And so if you are doing that, you can take these measures and put them in place so that you are as safe as possible. So unfortunately, the pandemic is still doing its thing, but that does not mean other illnesses aren't occurring, and that goes for the same for foodborne illness. So just because you're taking these measures to protect yourself from the pandemic and from COVID-19, you still need to also protect your friends and family from foodborne illnesses. So a couple of things you can do to kind of keep yourself protected from foodborne disease is pack and transport food safely. So this isn't something that we talk about a lot, because we usually talk about food prep in the home where you're cooking and then serving immediately. So with packing and transporting food safely, so a couple of things is keeping food cold food cold, and hot food hot. So using gel packs, ice, any of that to prevent bacterial growth for your cold foods like potato salad. And then keeping hot food hot. So you don't want that food that you took so long to make in the oven, those baked beans, for instance, you don't want to let them rise to or cool down to like a lukewarm room temperature. So you could use insulated containers, covering with foil, and serving immediately. So you just don't want it to get into that danger zone between 40 degrees Fahrenheit and 140 degrees Fahrenheit. So you want to keep it either cooler or hotter. Another way to do that is keeping your coolers closed. We know you're bringing coolers in with drinks, maybe lunch meats, all of these different types of things. And so so you want to keep your coolers closed to kind of keep it cold in that environment. Don't cross-contaminate. So as Dr. Sabaya mentioned in the chat, having different utensils for raw meat and cooked meat, making sure that you are not using any utensils that go between vegetables and raw meat. Really try and kind of keep that limited to nothing when you're cross-contaminating. You know, that's one really good way to protect yourself. And then clean your produce. You don't need any special, you don't need to use your Dawn soap. Don't use that. Just use water. Rinse your fruits and vegetables under running tap water before you're packing them in the cooler. So that is also including fruits and vegetables that you don't eat the rind. So cantaloupe, watermelon, you still need to wash those things before serving them. A couple of things for kind of cooking on the grill is marinate your foods safely. So marinate foods in the refrigerator, never on the kitchen counter, or especially not outdoors. You need to keep your food cold before you cook it. And so marinating it in the refrigerator is one good way to protect yourself from foodborne disease. Cooking food thoroughly. So when it's time to cook the food, have your food thermometer ready. Food thermometers are relatively cheap and pretty accessible. You can find them at most grocers. You can find them, I know, at Dollar Tree, Dollar General. And so they are accessible, and it could really prevent some foodborne disease. Color is not a good indicator. I know that we fall victim to that when it comes to cooking your chicken to where it's no longer pink. That is not good enough. Sometimes for instance, chicken breast will turn to that white opaque cooked color before it actually reaches the proper temperature. And then again, don't reuse platters or utensils that had raw meat for your cooked. So you have your raw meat plate, you move it to the grill or to the oven or to the stove. Put that plate in the dishwasher or in your sink and get a clean plate and clean utensils. Otherwise, you're just bringing those potential bad bacteria into your delicious cooked food. And then ultimately, when you're thinking about food safety, what you can remember is clean, separate, cook, and chill. So clean, wash your hands and surfaces, especially after handling those raw meat products. Separating your raw meats from other foods. You don't want to cross-contaminate your raw meats with vegetables in your salad that won't be cooked. cooking to the right temperature. So making sure it gets up to that temperature for whatever meat product you have, and then chilling, so refrigerating foods promptly. You don't want to leave it out. We don't want to get into that danger zone. A good rule of thumb is if it is over 90 degrees outside, you need to have that food cooled and chilled and refrigerated within 1 hour for it to be safe. And so over here on the right, if you go to the DFEND website, we have all sorts of fast facts that have a little bit more detail, so you don't have to remember all of this information when it comes to food safety, cooking temperatures, the clean, separate, cook, and chill, foodborne illness in the pandemic, all of these different things that you can kind of go back to and look at.
Thanks, Sarah. So yeah, just to kind of close out some of the content for this week, we do want to encourage you to go to our website. We had a lot of new recipes posted between last week's Fad Diet Talk and this week's July 4th, and kind of like summer rolling in with social gatherings. So check out our website. I know Sarah posted in the chat the link to both our website, which has a recipes tab with all of our written recipes, as well as our YouTube link. And Dr. Baum also put a link to a few recipes in there as well. But these are the ones that were just posted this week alone. And the ones with the asterisks have video demos that you can find on our YouTube channel. But again, there's well more than just this on our website in terms of recipes and the YouTube channel. So we do encourage everyone to go check that out. And then this is kind of just recapping a little bit more about what Dr. Baum started this call with in terms of next week. We'll be off for Project DFEND, and then it will resume on July 10th. So that's pretty much all we have for today. So I guess we can just open it up to questions or comments in the chat as people wish.
And for those of you who may not have joined in right away, we'll be coming back with DFEND, and it will go through December, and it will be a little bit different as far as more like a nutrition short course. So we'll really try to cover hot topics and nutrition and physical activity, but also do some pre and post assessments for those of you who sort of want to follow from start to finish related to health and sleep and mood and dietary habits. Yeah, so does anyone have any questions for Sarah or Angela or anything they hope to see in a short course? Yeah, so we'll try to have the latest nutrition and physical activity research, not just from Fayetteville, but from UAMS, and some Meet the Experts. So we'll try to bring in more people that are experts in hot topics to give short presentations and answer questions. Well, we thank everyone for your enthusiasm, and we really especially thank Extension for funding this event. So does anyone else have questions?
I have a question.
Mm-hmm.
On your course, are you going to, how would that work, or are y'all still working on how it's going to work?
I think it will be the exact same format as we're doing now. So I think it will be less, less diversity in fact sheets every week. So we're really going to, so, we may start and just have one course about like, what is appetite? And talk for 10 or 15 minutes about the difference between appetite and hunger, and maybe put some fact sheets describing that, and maybe more short lectures. But then, my idea was if we talk about appetite one week, let's bring in an expert in appetite to present some of their, findings the next week. And I need to get in touch with the Dietetics Association. So I'm going to try to get some continuing education credit or see if we can qualify for that. And I think for like, if you need courses or extension certificates, I can figure out how we can track that as well. And so the idea is we just want to, so part of it to figure out, could we get funding to do this on a larger scale, would be these pre and post assessments that we would ask people to kind of participate in a research study to see if habits change with more information. And so I know there were a lot of questions about like microbiome, and we never got there. So maybe one week we would talk, what is the microbiome? What foods trigger your microbiome? And then maybe the next week have a talk about that from an expert. So we kind of maybe wanted to make it more factual instead of a catch-all over 6 weeks for every question, but also keep it relevant. So if there's something that's, oh yeah, the non-meat protein topic. Yes, thank you, Diane, because that keeps coming up and keeps getting kind of bulldozed over by other topics. So that will definitely be one. We'll talk a little more about proteins, different kinds of carbs and what they mean. So it's more just to cover everything and less of a rush would be our goal for that.
So will the target audience be anybody? And would we, like you would want us to advertise in the county through our social media means? Is that how we can help with that?
Yes, so we would do that. Sorry, I just saw some blue squiggles on our
Yeah, me too.
screen. I'm not sure who was helping us along here. So I think it would be anyone. It's going to be tailored to an audience that you don't have to be a scientist or have a background in nutrition to understand what we're saying. So yeah, I think it's I teach, so there's another professor within food science. We teach like a food for health course where we focus on hot topics, but really about the science. But I've also taught the freshman dietetics course. And both those courses are really popular with like the seniors program for coming into audit classes. So I think they're always really popular, and somehow taking that information and targeting it to the general audience. So some of you may say, oh, I already know about this and this is too basic, but you may want to call in on like something about gluten and learn more about that. But we're hoping to get, be able to do some assessment and some evaluation this time to see how helpful people with like, more data, how they find it and can reach out. And then in the spring, we didn't do it this year because of COVID. We usually have a more scientific half-day conference that we live stream on a hot nutrition topic with scientific experts.
I don't know if it would be possible, but something to think about for the future is, the FACS teachers in the state, many of them teach nutrition in their classes, and they have to get continuing in service.
Okay.
And if there's a listserv for FACS teachers.
Okay.
There's also one.
Is that what it is? Is it FACS teachers?
Yeah.
Okay.
When you teach in public school or high school, we say FACS. I say we because I'm a former teacher. So we say Family Consumer Sciences. So we say we teach the FACS, instead of FCS. But it's the same thing. So I think, a way to market it as you expand is through professional organizations and through the FACS teacher listserv. And also there's a private group, and I'm a member of it. I've kind of kept my FACS connections just, for fun.
Okay.
And there's a private group that we, could reach out to and say, you could do it for just your information, or you could, for continuing it. I don't know that you could get that counted, but the State Department of Education, they can approve some in-service hours.
Okay, I can.
So
do you know who to contact, Pam?
Okay, I'll send you what I know.
Okay, and then I can look.
Just some thoughts.
I think that's really a good idea, and I think you're voicing things that I've heard over the years and just haven't been sure how to go about doing it. And I think whether or not we're partially homeschooling, I would hope that at a high school level, most students would be able to also understand what we're talking about with diet and physical activity. And I think so the idea is just to keep it going. Like, clearly nutrition and exercise are things people have a lot of questions about. So we thought, let's just fill in some of the gaps at the baseline level so we can build upon that for more and more. And so to help people also be able to evaluate what they're reading on the internet. So yeah, we're really excited to start it. So we're going to take a couple weeks break to regroup, make a syllabus, and then that gives me time to look into all these continuing education options. So, any other feedback, questions? No. Okay, yeah, so it's really, I think, and we'll record it. So now that Nick has been able to help us with Zoom and record things, we can then post that in YouTube as well. So for people who don't, or on our website for those who can't see it, so you don't ever miss a session. So yeah, so is microbiome separate from gut health type diet foods? I'm seeing more articles about how specific foods can affect how people feel. So I think they're in the popular press, microbiome is probably, you know, the sciencey dork term that we use. But when people talk about gut health type diets, I think they probably mean diets that impact like these bugs or this microbiome. And specific foods, how people feel. So I think you'll hear more and more about health and well-being, especially, you know, during COVID-19, and it's more about how you feel and not necessarily how you look. That's the mindset of changing with nutrition and health. And so I think that's why you'll probably start seeing a lot more things about diet and how it makes you feel rather than how it makes you look. There's like a mindset shifting in nutrition world. So yeah, I think, yeah, but these are all topics we hope to cover as we go forward. High schools have programs in nutrition. Yeah, so that's a good idea for remote learning. So I think, you know, like it's going to be co-led by Aaron Howie, who's also a professor at the U of A, and we'll have to figure out the right people to contact over the next couple weeks to make sure we can get continuing education going. So, well, thanks everyone. If there's no other comments, we'll see you back digitally on the 10th. Enjoy your 4th of July. Thank you.